Now, the Young African Leadership Initiative concluded recently after 6 weeks with about 700 Mandela Washington Fellows. 100 of them have been selected after training to participate in professional development experience internships here in the United States. One of them is Samuel Fayiah Johnson, a capacity building officer in the Governance and Decentralization Unit with Liberia's Ministry of Health. Samuel joins us live via Skype from Phoenix, Arizona, where he is interning. Samuel, welcome to Africa 54.
Thank you very much again, Lena. Thank you.
So you are from Liberia, and the country experienced an Ebola outbreak a couple of years ago. Tell us how the health system is faring now after the outbreak.
Well, 4 years on, Liberia health system is moving forward. Liberia health system has improved. Ebola did expose the vulnerabilities of our system, so we are now strengthening our system in terms of emergency preparedness and surveillance. And we are doing well as a country, we are doing well as a system. And in terms of leadership, we've now mapping and also aligning resources to priorities. And we think we are kind of prepared for emergencies. I said in my previous interview that the advent of meningitis in one of our counties showed to the world that our surveillance system through the National Public Health Institute of Liberia with support from the Center for Disease Control, CDC, is up to the task.
Okay. Now tell us about some of the priorities as you talk about strengthening the healthcare system in terms of preparedness. Quickly tell us one or two priority areas.
One basic priority area is the supply of essential medical supplies for the health system.
Okay.
That is one particular area that needs focus, because in as much as the system is being strengthened, once materials or medical supplies are not provided, it impedes all efforts to get drugs across to those in need.
Okay. Now, how is the Mandela Fellowship helping you to improve your skills in terms of helping your country's healthcare system?
A little over 50 Liberians have benefited from the Mandela Washington Fellowship. And these Liberians are from either the private sector or the public sector. And for me, more specifically, the Mandela Washington Fellowship is greatly helping to shape my own thoughts about how I go about doing my work in my country. Where I'm currently interning, I'm being exposed to rural sector decentralization. Like I said, I work as a capacity building officer in the Governance and Decentralization Unit.
Yes.
So I'm being exposed and getting access to what's happening in Phoenix, Arizona here, and what I can learn from that. From the office level, I'm also strengthening my ability or skills concerning health policy analysis. So it is an opportunity that is really helping me to move forward. And I know with the knowledge and best practices I'm acquiring, I will continuously impact my health system.
Okay, Samuel, we have to leave it there, unfortunately. Thank you so much for joining us today.
Thank you very much, Lena.
And that was Samuel Fayiah Johnson. He is a capacity building officer with the Liberian Ministry of Health. He is also a Mandela Washington Fellow.